Our group project is on health informatics, reducing medication errors through use of the Epic EHR system.
So, talking about Epic as an application, the Epic Systems Corporation is a leading provider of electronic health records or EHR software, and it's used in hospitals and healthcare organizations around the world. The EHR system that Epic uses integrates clinical, financial, and operational data, which allows seamless communication across healthcare providers. And Epic is used by over 325 million patients worldwide. Commonly used tools that are available within Epic are MyChart, which is a patient portal that you can use for patient scheduling, messaging providers, and test results. Hyperspace, which is the main interface for healthcare providers to document medication administration, vital signs, and assessments. Care Everywhere, which is the interoperability tool to share records between health systems. Clarity and Caboodle is a data analytics and reporting tool, and Haiku is mobile applications for providers. So Epic's founding and its roots, in 1979, Epic was founded in a basement by 3 part-time employees. Judith Faulkner established Epic, or is considered to be the one to establish Epic in Madison, Wisconsin. She invested $70,000, and originally it was called the Human Services Computing, and Judith Faulkner is still the CEO of Epic. In 1983, Epic developed its first database-driven patient record system, which allowed for electronic medical documentation, which for its time back in the early 80s was not something that was common as technology was not readily available. In 1992, Epic introduced its first electronic medical record, making medical documentation more user-friendly. In 1994, Epic shifted from serving small practices to working with large hospitals and healthcare networks. And then moving into the 21st century, in 2003, Epic launched MyChart, which is one of the patient portals that we talked about, which allows patients to view test results and communicate with their doctors. Then the next year, Epic rolled out Care Everywhere. Like we said, it allowed hospitals to share patient records across different hospital systems within Epic. In 2005, Epic moved its headquarters to Verona, Wisconsin, and built a campus-style headquarters inspired by other tech companies like Facebook, Google, and Apple. Some features of this headquarters were a treehouse that was used as a conference room, a huge waterfall that flows under a real wooden bridge, underground tunnels, and they have an intricately designed Harry Potter-esque themed room. In 2009 to 2010, Epic is growing rapidly due to the High Tech Act being passed in Congress. And then in 2016, Epic introduced or rolled out Caboodle, which is a data analytics and reporting platform. Moving forward from 2020 on, Epic has started to integrate AI to have predictive healthcare analytics. They've increased their capabilities in response to the COVID-19 pandemic, and they have shifted their focus to a global expansion. And now Epic maintains the largest market share for acute care hospitals, which is 29%.
Health informatics plays a crucial role in improving medication safety by integrating technology and data management into healthcare practices. The purpose of health informatics is to enhance medication safety through electronic prescribing, clinical decision support systems, and automated alerts, all of which help minimize the risk of medication errors. By standardizing workflows, these systems also reduce human errors that may arise from inconsistencies in prescribing and administration process. Health informatics systems play a crucial role in reducing medication errors by integrating technology into prescribing, dispensing, and administration processes. By integrating these technologies, health informatics significantly enhances medication safety, reducing the risk of preventable errors in the healthcare setting. Health informatics systems use multiple inputs to enhance medication safety. Physician orders reduce errors from handwritten orders, while pharmacy databases track stock and interactions. Electronic health records data, including allergies and lab values, guides safe administration. Clinical guidelines provide standardized recommendations, and barcode medication administration ensures accurate medication delivery through barcode scanning. Together, these inputs help prevent errors and improve patient care. Health informatics systems enhance medication safety through key outputs. Real-time alerts prevent errors, audit reports identify trends, and pharmacy systems ensure correct dispensing. Patient education materials provide usage instructions, while EMR feedback tracks administration accuracy and policy adherence. These outputs improve safety and efficiency in medication management.
There are three major types of reports: clinical, operational, and financial. Clinical reports look at patient data to identify trends or gaps occurring in care delivery within the patient population to then help support clinical decision making. Operational reports look at operational efficiency and use that data for organizational strategic planning and decision making through increased data transparency and accessibility within Epic. Generated reports are also easy to export and share the data results with key stakeholders. Financial reports analyze the revenue and billing performances of healthcare organizations. The Medication Administration Record, also known as the MAR, is a detailed report of medications, their due and administration times, dosages, and routes, all for one patient, all within one place within the EPIC chart. It allows for detailed documentation of medication actions such as given, not given, held, and the reasons behind it, such as contraindicated or loss of IV access, etc. So on the right with the picture of the MAR, you can see looks like Zyrtec is due. You can see she stopped the D5 half normal, gave insulin, the long acting, but held, or not held, sorry. She didn't give the regular insulin, and it looks like there's a comment next to it. So it just allows us to be able to see what was done medication wise for the patient. Also, MARS use the barcode medication administration systems that verify the 5 rights of medication administration that have been shown to reduce medication error significantly. Also within Epic Mars, there is the tool that we can directly message and chat with pharmacy to adjust dosage times or request doses. Other direct links is a medical drug database such as Lexicomp within the MAR to provide additional references for drugs. Overall, having an accurate MAR helps prevent medication errors and maintain data integrity. Two Epic report tools are Slicer Dicer and Reporting Workbench. Slicer Dicer is a data tool within Epic's EHR to create custom visual data reports, such as charts, tables, and graphs. You select a data set and then add in filters to help narrow it down. An example data set could be medication orders, such as how many times was this specific drug ordered, and then adding in filters for age, gender, and location of the patients. Slicer Dicer is the most frequently used research tool by Epic users. Reporting Workbench runs custom operational reports using real-time data. It supports various user levels, from the ability to use pre-built templates for ease or customizing their data source. Filters are then used to refine results for specific needs. Examples of operational reports include unit or organization-wide BCMA scan rates, daily workflows, or regulatory compliance and audits. While Epic has a great foundation and has made many strides for the EHR world, healthcare is always changing, so the technology must follow. Epic has already started using AI-powered insights and plans on continuing to improve on successful implementation of AI to help with clinical decision-making. Epic also performs regulatory compliance updates to address bugs in software to continually improve on the EHR system. Another area for improvement that prevents organizations from Epic use is the hefty implementation costs and acts as a financial barrier. So an improvement would be to make costs more affordable for healthcare organizations.
There are multiple advantages of using Epic as an EHR system in order to reduce medication errors. Epic has something called improved dosage accountability. This allows for integration features between the Epic's EHR and a patient's medication administration records, which gives the system the ability to compare medications dispensed across other EHR systems and identifies any outstanding medication waste, which is a benefit for nurses, physicians, and anesthesiology providers. Another benefit is efficient medication queuing, which allows for the incorporation of Epic electronic health record information with the medication administration record so that healthcare providers can monitor medication management and administration tasks within a single Epic EHR system rather than through multiple electronic healthcare systems. Additional advantages are improved controlled substance accountability across organizations, streamlined medication administration and management to ensure that the right patient gets the right medication, increased emphasis on accurate record keeping to improve data integrity to prevent medication errors, and streamlined integration with other Epic modules to facilitate better collaboration between providers. There are some disadvantages to using Epic as an EHR system to reduce medication errors. One of the disadvantages is information overload. While Epic has the ability to incorporate multiple data points from a patient's health visit into one space, lengthy patient history notes can overwhelm providers, leading to an increased risk for medication errors. Another disadvantage is inadequate staff training. If providers are not properly trained to use Epic's medication ordering features, they may be more likely to make mistakes while ordering medications. Notification fatigue is another disadvantage. This alert fatigue can contribute to sensory overload, which has been shown to alter decision-making. Customization and inconsistencies is another disadvantage. Hospitals have the ability to customize Epic to the needs of their hospital, but the downside to this is it can lead to inconsistencies in how medication is ordered, leading to increased risk of medication errors. Design complexity is another downside. The design features of Epic can be cumbersome to users, leading to confusion and misinterpretation of information, including medication ordering. Finally, the ability to override medications through the MAR is a safety issue, which can lead to medication errors by bypassing safety prompts. The impact of medication errors on the healthcare system is eye-opening. Medication errors are among the most costly and preventable causes of injury, disability, and death to patients. According to the World Health Organization, adverse events from unsafe patient care rank in the top 10 causes of death and disability worldwide. The impact of medication errors on nursing healthcare professionals can cause psychological distress, and depending on the severity of the error, legal actions can be taken against nurses, which can interfere with professional advancement opportunities and even lead to loss of nursing licensure. Studies reveal that nurses and pharmacists identify between 30 to 70% of medication ordering errors. The impact of EHRs such as Epic in preventing medication errors is largely positive. EHRs can reduce medication errors by alerting providers to lab results in critical ranges, preventing errors that likely would not have been as easily caught by a paper chart. EHRs can also alert providers to potential drug interactions or contraindications to medications on admission for transplant patients at high risk of organ rejection. Finally, EHRs have safety features allowing providers to give clear instructions to patients on when and how to take medications at home that can prevent medication errors and prevent unnecessary hospital admissions. Thank you for listening to our presentation on reducing medication errors through the Epic EHR system.